Everyone's ready for drinks. Straight feet.
Oh, I don't chit chat, guys. Huh?
You want a tissue from my brother?
No.
She's a tissue dispenser.
Oh, Amelia, I'm about to ask if you need one. A tissue? Yeah. Yeah, she got it.
Yeah, use 3 just in case.
Thank you, guys.
If you don't use them, I'll use them in my Can I make them touch my boob? Is that like not appropriate?
Oh my God.
Like in the jar, it's like, yeah, you know. They're hard enough.
Oh my God.
These are soft, this is hard. Alright, let's go.
All right. Ready? All rise. The Superior Court of Lincoln Tax Criminal Division is now in session. The Honorable Judge Jack Allen proceeding.
Everyone but the jury may be seated. Ms. Gomez, please swear in the jury. Oh, Ms. Clark?
Please raise your right hand. Do you solemnly swear to affirm that you will truly listen to the case and render a true verdict in a fair sentence as to this defendant? Please be seated.
Members of the jury, your duty today will be to determine whether the defendant is guilty or not guilty based only on the facts and evidence presented in this case. The prosecution has the burden of proving the guilt of the defendant beyond a reasonable doubt. This burden remains on the prosecution throughout the trial. The prosecution must prove that a crime was committed and that the defendant is the person who committed the crime. However, if you are not satisfied of the defendant's guilt to that extent, then reasonable doubt exists and the defendant must be found not guilty. Ms. Gomez, what is today's case?
Your Honor, today's case is Rhode Island 84-54-231 and the State of Rhode Island versus Dr. Cindy Silicone.
Prosecution ready. Defense ready. You may call your first witness. Prosecution, you may call your first witness.
Is it okay if I read my opening statement?
Oh, Lord, I'm sorry, I forgot.
Good morning, Your Honor.
Good morning.
Good morning, ladies of the jury. I am Attorney Millie Alabama. I am here representing my client, Ms. Treasure Goldair. I believe Ms. Treasure is a victim of malpractice. She had a breast augmentation procedure done, and the results are terrible. Her breasts are uneven, as you can see. They have ulcers, and one breast feels different to the touch than the other. Ms. Treasure had some diagnostic tests done to see what exactly is wrong with her from another surgeon who is here in this courtroom today. And I have proof of evidence of this terrible procedure performed by Dr. Cindy Silicone.
The defense, you may proceed with your opening statements.
Good morning, Your Honor.
Good morning.
Your Honor and members of the jury, my name is Stephen Lugo. I am representing Dr. Cindy Silicone in this case. We intend to prove that Dr. Cindy Silicone is not responsible for these acts. Please find that the manufacturers of the implant needs to be investigated.
Prosecution, you may call your first witness.
Your Honor, I would like to call to the stand Maria Diallo.
Please stand and be sworn in by bail.
You swear to tell the truth, the whole truth, nothing but the truth?
Good morning.
Good morning.
Could you please state your full name, date of birth, and your relation to this case?
My name is Maria Diallo, and I am Maria Diallo's sister. And January 1689.
Okay, thank you. So, you stated that you had a sister that had a breast augmentation done, am I correct?
Yes.
Okay. Could you state your sister's name again to me?
Her name is Marie Dion.
Okay. Why did Marie Diallo want to have a breast augmentation performed?
Well, when we actually were younger, she just never really developed any big size or whatever. And, I mean, her husband used to just, it was just mostly what her husband wanted.
Okay. Is the defendant sitting in the courtroom today the one who performed your sister's breast augmentation? What did Marie do for work?
Actually, she wasn't employed. She was collecting from the government, SSI, agency.
Okay. Why did Marie collect SSI and food stamps?
She actually had an accident at work, so she broke her hip.
Okay.
She got a hit.
Okay, so there was no other illnesses or
No.
anything like that? And I understand you are the power of attorney for Marie Diallo, am I correct?
Yes.
Did Marie visit her primary care physician regularly and when she would feel ill? Like, did
Yes,
she go to the
actually.
doctor regularly?
Yes.
Okay. How long did it take Marie to save up money for her surgery?
Well, I mean, she was only collecting one check a month, so at least it took her a year and a half in order to save up for surgery.
How much do you know of, did Marie pay the defendant, Dr. Cindy Silicone, for her surgery?
She actually paid $700.
Was Marie excited to have her breast augmentation performed?
Yes, she was.
Do you think Marie was really excited because she maintained fidelity with the defendant? So she really trusted her and she had faith in her?
Of course, I mean, wouldn't you trust a licensed doctor?
Yes. Yes, I would. After Marie's surgery, how was she feeling?
She just wasn't herself.
No?
She was very sick.
Sorry to hear that. Did you notice any abnormal swelling of Marie's breasts?
Actually, yes, they're actually very swollen. And when I approached her about it, she just basically said that they were normal. That's how it's supposed to be. But
She went for a follow-up?
yeah, exactly.
So Marie was told that it's just normal? and
The swelling up and it will
go
go
away?
Yep.
How long was Marie feeling sick after her surgery?
I would have to say she actually went in for a sick visit with her primary doctor. And then after that, it was at least 4 months that she was just not herself.
Just not herself? Did Marie visit her primary care physician when she started to feel ill?
Yes, because she actually just,
I'm sorry, after the surgery? did she?
yeah, she actually went because, she was just having some crazy stuff like diarrhea and vomiting and fever,
And it just wouldn't go away?
and it wouldn't go away, so.
And you had stated that you're the power of attorney for your sister Marie Diallo?
Yes.
Okay, Your Honor, I would like to present Exhibit DD, proving that Maria Diallo is power of attorney for Marie Diallo, and also a sick visit, progress notes from the sick visit that she had with her primary care physician, and also her flu test.
May I continue?
went away. Did you notice by any chance that Marie's breasts looked uneven or lopsided or crooked or?
Yes, actually I did. They were lopsided or crooked, like they weren't how they were supposed to be. And I told her about it, and I told her maybe she should go to the doctor.
Can you tell me where your sister is today?
She actually ended up passing away. January 1st. I'm so sorry.
It's okay, just let it all out. Alright. I understand this must be really, really hard for you, but we really appreciate you being here today. Your Honor, I'd like to present Exhibit FF, certificate of death for Marie Diallo, signed by the coroner on the 1st of January 2012 at Rax Memorial Hospital.
You may continue. Marie's death sudden? Did it just happen suddenly or?
Yeah. They found her in the house.
Yeah. And then they brought her to the hospital. Marie had an autopsy report done, am I correct?
Yes, she did.
Your Honor, I would like to present Exhibit II, autopsy report from Curl Up and Die Laboratories. The autopsy was performed on January 2nd, one day after the death of Marie Diallo. Based on the examinations of Marie Diallo due to sudden death, they have found toxins in the bloodstream, cement implanted in the right breast, rubber materials implanted in the left breast, traces of limestone and shell.
You may continue.
So I know you stated earlier that Marie was unemployed. But Marie had no other health problems besides her hip that would affect her having the surgery.
Exactly.
She wasn't diabetic
No.
or like anything like that. Okay. And that's the reason why she was claiming it. One last question. What was your reaction when you found out about the findings from the autopsy? I'm sorry, I know it's really hard to do.
It was just, I was just speechless, like, how do you go end up getting breath augmentation and come out with rubber? I just,
The defense, you may cross-examine this witness.
You state for the court about physical necessary. Yeah.
our,
At work. You say it was a car accident?
what?
You say it was a car accident?
No.
When did your sister have this surgery? That's what you said, right?
No, I really didn't. But, she had her surgery done August 5th.
August 5th?
Mm-hmm.
You speak to your sister about having the surgery done?
Actually, yes, I supported her. Of course.
Who was your sister's surgeon?
Cindy Silicone.
A client?
Yeah.
Alright. Did you notice any complications during the surgery, after the surgery?
RP size, like, I mean, her breast was swollen, but like I said, she said that, she stated that it was just, it's supposed to be like that, it's supposed to pass. They just never did.
When did your sister pass away?
Considering first.
What was the results of the
The result, well, like, as stated, it had, you know, rubber and like cement and, yeah, and shells and stuff like that. Put it on paper.
Step now.
Isn't that? I'm done.
Prosecution, you may call your next witness.
Okay.
Oh, thank God.
Your Honor, I would like to call Dr. Love to the stand.
Stand to be sworn in by the bailiff.
You swear to tell the truth, the whole truth, nothing but the truth?
Good morning. Could you please state your full name, date of birth, and your relation to this case for the courtroom?
I'm Dr. Corinne Love. My date of birth is 7/1/1990. And I'm a cosmetic surgeon that Miss Treasure Golden came to get her.
Dr. Love, can you state what your occupation is?
I'm a cosmetic surgeon.
How long have you been in the field?
10 years.
Okay. Do you perform breast augmentation?
For the most part, yes.
Okay. What kind of breast augmentations do you perform? I know there's several different kinds, so.
Like reconstructive, cosmetic.
Do you use like refill, silicone,
It depends on what kind of surgery
how often do you perform breast augmentation?
I'll probably do 5 a week.
Dr. Love, could you tell us how much a breast augmentation would cost?
I charge $20,000.
Okay. Dr. Love, how much does your equipment cost?
Usually $5,000 for my equipment.
Okay. Dr. Love, do you remember seeing my client, Miss Treasure Golddigger?
I do.
Okay. Can you tell me when she came to see you?
She came to me June 26th,
Okay.
2020.
Okay. I understand that you have progress notes from that actual visit, am I correct?
Yes.
Okay. Exhibit HH, this is a report of progress notes from the visit. Ms. Treasure Golddigger has went visited Dr. Love for a second opinion. Has her vitals stated on the top and an explanation of what had happened at that.
You may continue.
Dr. Love, can you explain to the courtroom what you had found wrong with my client after just just visually examining her without any diagnostic tests or anything, just visually, what did you find?
Her left breast was bigger than the right. She had ulcers starting to form on both breasts. Her incision sites were they had glue on them instead of stitches, regular stitches.
You must have been really shocked.
How's this down?
You must have been asking yourself how Your Honor, I would like to present Exhibit KA. It's a visual picture from Dr. Love of Ms. Treasure's breast with the ulcers and the actual deformity of the breast.
Continue.
Okay, so after visually examining her and what diagnostic test did you order for my client this study?
I ordered CBC
Okay,
right away and an X-ray.
okay. What did you see on the X-ray?
There was both breasts were abnormal with some type of solution inside, or they weren't right.
Your Honor, I want to present Exhibit BB. This is an X-ray. Just keep in mind that anything that's dark looking on the X-ray is hollow, or clear, I should say. Anything that is white is a solid, that's glowing cold. You can see white. Anything other than the bones that are there that is white is something that is solid in the X-ray. Also, I would like to present you her lab report for her CBC. Her bilirubin was very high. Thank you. Dr. Love, could you tell me what are you going to do to help my client after seeing those diagnostic tests and the visual examination? What are you going to do to help my client?
Well, first I'm gonna schedule a reconstructive surgery as soon as possible and remove her all that stuff that's inside. And I'm gonna use it's called the Keller file. What I usually do is instead of making an incision under each breast, I usually go through the nipple and I make a 1/2 inch incision and I open it and the funnel is you fill it with saline, antibacterial saline, and you put it inside the nipple and you just push it through without, there's not a lot of touching going on in there, and it's very quick.
So, Dr. Love, saline is clear, am I correct?
Yes.
Is silicone clear?
Yes.
Okay, so if you were to do an X-ray on Miss Treasure Golddigger and she had silicone or saline in her breast, would you see the X-ray as white, or would you see it as dark, like in a hollow?
You would be able to see the outline of the implant, but nothing that looks hollow.
It would be like a solid
More
mass,
clear.
like a
with
bone.
no-
Okay. Treasurer if you didn't reconstruct her breast?
Her health would completely deteriorate.
Your Honor, I would like to present actually not an exhibit. I'm not sure what to- I just want to show you that Ms. Treasure has a surgery scheduled immediately after the diagnostic test came back. So I just have her consent form, exhibit LL, from Dr. Lowe.
You may continue.
Dr. Lowe, would you ever charge a $700 small fee to perform a breast augmentation?
Absolutely not.
How about would you ever accept a $700 down payment in payments monthly? Why not?
Because I feel like it's not enough for my equipment and the procedure that I do.
Do you offer any other financial help for patients that want to have their surgery done?
I don't really do sliding scale. I finance usually year one credit.
That would get paid regardless. I have no further questions now.
Defense, you may cross-examine.
Dr. Love, what is your job description?
I'm a cosmetic surgeon.
Cosmetic surgeon? Did you say Mrs. Treasure's x-ray? When was the x-ray done?
June 26th.
What did you notice that was unusual about the x-ray?
There were large masses. Each were different sizes and each were.
What did you advise your patients to do after you know there was something wrong?
Well, because her fever was running so high, I advised her to go to emergency room. And I had to order for reconstructive surgery as soon as I could.
You didn't advise us to my client? Did you consult with any other experts in the practice after seeing the x-ray results?
No,
Why wouldn't you?
because I have my own practice.
I'm saying you being a professional as you are, you said you been in practice for 10 years, right?
Yes.
I would think that something like this unusual, I've never seen like something like this before, you would at least consult with somebody else, you know, just in high rank.
Objection.
Overruled.
Would you say by your actions that the x-ray that you fulfill your obligations to the public?
Yes.
You agree on that? No further questions, Your Honor.
Would you like to rebuttal?
What? Yes, yes, Your Honor. I forgot that word. I just have one more question for you, a couple actually. Ms. Lugo had asked you, you have been in practice for 10 years, and why wouldn't you, consult with another physician or somebody else about that situation? Am I correct? And I'm sure you follow the rules and the laws of the HIPAA,
Yes.
correct? Thank you. I have no further questions.
Please step down.
All right.
Prosecution is on your 30 minutes.
That's on there.
Your Honor, I would like to call to the stand Ms. Treasure Goldigger.
Will the witness please stand and be sworn in by the bailiff?
Good morning.
Good morning.
Could you please state your name, your date of birth, and your relation to this case?
Treasure Golddigger, 8589, and trying to get rid of this awful doctor right there.
Okay. Miss Treasure, what is your occupation?
I am a receptionist at the clerk's office.
Okay. So your hearing is very important
Correct.
when you're a receptionist. You're probably one of the first people they see when people walk through the door, am I correct?
Correct.
And first impressions count for everything, don't they? Are you single or are you married?
Single.
Miss Treasure, how many hours do you work a week?
Probably maybe 25 at the most.
Okay. How much per hour do you make?
Just minimum wage.
Minimum wage? Okay. Is it a struggle to pay your bills and get by every week?
Yeah, pretty much live paycheck to paycheck.
Ms. Treasure, can you tell me about yourself when you were growing up? I mean, focusing more on the emotional views that you went through when you were growing up.
You know, it's so tough growing up as a girl around a bunch of guys. You go to school, you get picked on. I got picked on so many times about my breasts. You go to school, all these girls have these nice blue breasts, sorry. And you walk around, you know, they say, you know, books aren't everything, but it just helps a little bit with like the self-confidence level and such.
Right. So every time you went to school, you were antagonized, or you would cry, or your feelings would get hurt, and
Yeah, one kid decided one day to say to me, Gianna, if you, Treasure, if you didn't have feet, would you wear socks? I said, no. And you know, whatever. He goes, if you don't have boobs, why would you wear a bra? That was so sad.
that's terrible.
I know. See what I'm saying?
Boys these days, I think so. I don't get it.
I almost really cried.
How did your parents treat you when you were growing up also? I mean, I remember before saying, you know, everyone in your family has like,
They
you
were
know,
nice.
nice breasts,
Yeah.
but you ended up,
I mean, my brought up was very well. But, you know, looking around my cousins and sisters and stuff like that, and my mom, you know, like, they looked down upon me, but they would, like, rub it in my face that, you know,
Yeah.
they got blessed and we didn't.
yeah, so they would tease you here and there.
Exactly.
You must have had a very low self-esteem
Very.
when you were growing up, very self-conscious of your body, and, you know, you were very shy, and,
Yeah.
am I correct? That's basically how you feel. How often were you bullied about being, you know, quote unquote flat-chested?
Every day of my life.
Every day of your
Yeah.
life? You came to a point in your life that you decided to have a breast augmentation done, am I correct?
Correct.
How long did it take you to save money for it?
That breast fund jar didn't get filled up for maybe about 2 years, just because, like I said, I don't make enough money to put a lot in it.
And you really wanted to focus on changing your bodies to make yourself as a person feel better about yourself.
Yep.
And you weren't doing it for anybody else, it was
No.
just for you. surgeon's name that performed the surgery on you?
Dr. Cindy Silicone over there?
Okay. Who's the defendant?
Correct.
Did you have a consultation with the defendant?
Yes.
Okay. What did the defendant tell you at the consultation?
She pretty much explained the procedure and what was going to be done. We decided on getting 450 cc's, so she said my breast would be at least 2 cup sizes.
Objection, Your Honor. Objection, the witness is not qualified to give a specific amount of cc's.
Sustained.
So you went through the whole consultation and she basically went to you what she was going to do. Was there anyone else in the room with you during the consultation?
No.
I understand Dr. Silicone gave you a picture of before and after picture to give you an idea of what your breasts should look like. Am I correct?
Correct.
Okay. I have a picture that I would like to present to you. It's a before and after picture. It's exhibit JJ, before and after picture from Dr. Cindy Silicone. Just to give Ms. Treasurer a rough idea on how much bigger her breasts would look like after the procedure.
You may continue.
When it came time to discuss payment, what was Dr. Silicone's reaction when you told her you only have $700?
She felt bad. I mean, she pretty much knew how much I was really wanted to send to her. So she told me that all I had to do was give her the 700 and cover and I'd be able to have surgery.
Ms. Treasurer, how were you feeling after you had the surgery done?
Right after, I was, excited that I was finally going to have bigger breasts.
When you went for a follow-up, what did they say to you?
I had questions about the unevenness and the swelling. She had said that sometimes one unswells faster than the other, so the unevenness was normal.
Okay. When you went for your follow-up, who did you see exactly? Did you see Dr. Cindy Silicone? Did you see two? Did you see anybody else in there?
I saw Dr. Cindy Silicone and Miss Christine.
Her sister?
Correct.
Can you describe to me what your breasts feel like?
Well, they are, the right side is droopy, not you feel my breasts, but they're droopy and saggy on the right side. On the left side, it's very hard, a little lumpy, and on the left side, I have ulcers that are going down my nose.
I could visually see that they're uneven. And that's when you realized you needed a second opinion, is when you realized when the swelling went away, am I correct?
Yes, it just didn't seem normal that the swelling is like, they go down at different times. I would think that they would both go down the same time.
Right. Can you describe your emotional state when you realized your breasts were not what you really, really hoped for? I know you were emotionally abused, most of your life, and you were very, you had very low self-esteem, and so I can't even imagine what your emotional state was when you realized that your breasts were not what you hoped for. Can you
It
describe?
was depressing. I mean, I was let down. Like I said, I was so excited to have bigger breasts. And then seeing this, I was like, I wasted $700 pretty much, because like I said, I could use the $700 for that
I understand that you went to, I mean, you had to go to Ecuador for your work. And I know missing only one day of work is extremely important to you. Every dollar that you make counts because you struggle every week to pay what you need to pay for. So I can relate, you know, if you were well enough, you went to Ecuador for work, you thought you were well enough, you went and did that. Am I correct on that, in those lines? Okay. Who did you go see, I'm sorry, did you go see Dr. Love for a second opinion?
Yes, because like I said, after my follow-up silicone over there, I didn't feel like, you know, what she had told me was right, so I wanted to see somebody else.
Were you shocked at the results when your diagnostic test came back?
I honestly wasn't surprised, because like I said, I didn't think that everything was normal. It just kind of sucked that, you know, it had to come down to that.
And were you worried about your health?
Of course.
I was been very worried. And so Dr. Love scheduled another surgery for you.
Yes.
How do you feel about that?
I'm very nervous.
Yeah.
Just because, I mean, you know, but I'm happy in the same way that Gilby fits.
Okay. And that's what the surgery is for?
Correct.
I have
At this time, we are going to take a break for a recess. This court is now in recess.
Ooh.